I'm Isobel Mackenzie, Seniors Advocate for the Province of British Columbia. And first, I would like to acknowledge that we are gathered here very gratefully on the territory of the Lekwungen-speaking peoples and the Songhees and Esquimalt nations. As all of us know, on March 18th, 2020, BC declared a public health emergency due to the COVID-19 outbreak. And since that time, lives have been upended and sacrifices are being made by everyone to keep ourselves, our loved ones, and particularly our elderly safe by staying at home. Most seniors are able to live at home because they have a family caregiver who helps them. This can be a spouse, an adult child, a grandchild, or sometimes a devoted friend or neighbor. Family caregiving can be intense for many people, especially those who live with the person they are providing care for. It is stressful in the best of times, and I think we can all agree we're not in the best of times. I have spoken in the past of the challenges faced by family caregivers and additional supports that were needed. We were seeing the beginning of some promising improvements. However, the public health measures we have needed to take to keep seniors safe has impacted these, as well as other supports available to family caregivers. For example, many family caregivers who take care of their spouse or their mom or dad rely on adult day programs to get respite for a day or two during the week. This resource is no longer available as we've closed our adult day programs during this part of the COVID pandemic. Some families would enjoy a week or as much as a month of respite when their loved one went to stay in what we call a respite bed in one of our long-term care homes in BC. And this has also effectively been suspended as we focus on containing the spread of COVID-19, particularly in our long-term care homes. Still others might receive respite from a care worker who comes into their home and allows the family member to get out and run errands and be out and about in the community and get some relief. Now, with COVID-19, we're finding that some families are canceling some or all of their home respite in order to control the number of people that are coming into the home. Or when the home respite arrives, there's nowhere now for the family member, the family caregiver to go, as senior centers are closed, recreation centers are closed, libraries are closed. And we are specifically saying to seniors and people who live with seniors that now is not the time to go out and about. Family caregivers supporting seniors number in the hundreds of thousands in British Columbia. And we know there are over 30,000 who provide significant care, such as bathing their loved one, helping them to the toilet, helping them to eat, and being constantly at their side. I hear from family caregivers often about how unbelievably rewarding they find the experience of being able to provide this level of intense care to their loved one, but also how unbelievably exhausting it can be. While family caregivers continue to support their senior loved ones through this pandemic, we must also find a way to continue to support our family caregivers, because they are the backbone of seniors' care in this province and in this country. And that's why we are here today. The Safe Seniors Strong Communities Committee, which is an all-party committee convened by Health Minister Adrian Dix, has highlighted the need to ensure family caregivers are supported as it becomes clear that the new normal, when we get to it, will continue to impact family caregivers. The Ministry of Health and the family caregivers of BC have developed a plan to better support the family caregivers and their loved ones during this pandemic. And today we are announcing an additional $500,000 in funding for the family caregivers of BC. This funding will allow the family caregivers of BC to increase the capacity on their helpline and to expand their virtual toolkit to ensure family caregivers across BC can reach out and connect with each other and know that they are not alone. Family caregivers can call 211 and be connected to the Family Caregivers Helpline, or they can call directly to 1-877-520-3267. I'll repeat, they can call directly to 1-877-520-3267, or they can call 211 and they'll be connected. And there are the websites, familycaregiversbc.ca or bc211.ca, and you can link directly to Family Caregivers website. To family caregivers out there, my message is simple. If you are feeling overwhelmed, call the Family Caregivers of BC, either through the 1-800 number or let BC211 connect you. There is support. You are not alone. I know the help you really need right now is some relief from your caregiving duties and some time for yourself. And that's incredibly challenging to provide for you right now, and I am very sorry about that. But you may find some comfort if you can share your burden with those who understand it best. Please don't try to shoulder this burden alone. Please call Family Caregivers of BC directly or connect through 211 and allow them to help. The COVID-19 pandemic has been especially hard on seniors and the people who care for them, both the healthcare workers and the family caregivers. I am hearing from many seniors on a daily basis of the challenges they are facing. And as we continue to evolve through this pandemic, a number of supports have been put in place to assist seniors, and I expect there will be many more as time goes on. And I would like to just give an update of some of these supports. An earlier initiative proposed by the Safe Seniors Strong Communities Committee was the Safe Seniors Strong Communities Initiative, and it was funded by the provincial government. It partnered with BC211 and the Better at Home program to match British Columbians who want to help seniors with groceries, medications, getting some meals, or providing a friendly virtual visit with seniors who need that help and want that help. And it is as simple as calling 211 or visiting the website, bc211.ca. And if you need help or you want help, you're going to be connected and you're going to get the help you need. It was launched 4 weeks ago, and to date, the program has now delivered over 21,000 services to BC seniors. This includes 12,193 virtual visits, 2,957 grocery deliveries, and 2,782 meals. And these numbers grow each day as more BC seniors reach out for help and as more British Columbians come forward to help. There are over 5,500 British Columbians who have volunteered so far, and it grows every day. It is very heartwarming and a fitting tribute as we conclude National Volunteer Week here in Canada to acknowledge the incredible efforts made by these volunteers. I see selfless acts of kindness being extended to seniors in every neighborhood of this province, sometimes through the 211 program, sometimes just through spontaneous good neighbor gestures. And I cannot express enough my profound gratitude. Governments have also been showing their support for seniors in a number of other initiatives. There's been support for the most frail seniors who live in long-term care and assisted living, as the provincial government provided $10 million to enhance infection control in long-term care and assisted living. And my thanks to the BC care providers for agreeing to help the province distribute this money as quickly as possible. The province is also funding tens of millions of dollars in the long-term care sector to quickly get the vital care staff in long-term care the wages necessary to ensure they can reasonably continue to work and to work at only one care home. And my many thanks to the unions and all of the employers for recognizing and supporting the importance of this. The province funded Safe Care BC to launch Operation Protect, a way of getting donated PPE, which many of you might not have known before this started, but is personal protective equipment, and to get people who want to donate PPE to healthcare workers who need it. And my thanks to the many, many organizations who have donated hundreds of thousands of pieces of personal protective equipment, PPE, through Operation Protect. The most impoverished of seniors, those who receive the monthly low-income senior supplement, will see an additional $300 a month for 3 months. And this will be an absolute lifeline for these 53,000 plus seniors whose incomes are less than $19,000 a year often. I have certainly heard from very low-income seniors that life is even more difficult under COVID-19 restrictions. Many of these folks depend on senior centers and libraries for their news and internet access, and they're feeling cut off as these opportunities are no longer available. And the costs for certain necessities, such as groceries, are rising, and they have extremely limited incomes and no possibility for additional income. So the increase to the senior supplement for our low-income seniors is really very, very significant to some of our most marginalized seniors who live in a great degree of poverty. Many younger seniors are still employed, and they depend on that employment income to meet expenses. So there are, as we know, a number of income replacement programs at both the federal and provincial levels, and that will be very helpful as seniors who need to earn that income to make ends meet will find some replacement for that income. And the Shelter Aid for Elderly Renters, or SAFER grant as it's more commonly known, will allow seniors to apply to have their rate adjusted if they've experienced a loss in income. So that will be very helpful. The federal government has extended the timeline for filing income tax, and they have reduced the registered retirement RIF withdrawal limits for 2020. Those will be important, and my office will be connecting with both the federal and provincial governments to ensure that all programs linked to the filing of tax returns have date adjustments as well. There are a number of programs such as GIS, OAS, Fair Pharmacare, SAFER, that are all linked to a senior's income tax return, and a timely filing of an income tax return is important. So the extension was important, and the ability to link other programs and ensure those extensions are made as well will be vitally important. As the seniors advocate for BC, I have been heartened by the concern expressed for seniors throughout this pandemic. The provincial leadership under our public health officer and my colleague, Dr. Bonnie Henry, has from the beginning known of the deep impact on seniors, and the public health measures have consistently focused on keeping seniors safe. The provincial health minister, Adrian Dix, has been steadfast in his leadership on supporting seniors, and the nonpartisan approach embraced by all political parties in BC has been incredibly helpful in allowing I certainly see this "we are all in it together" approach up close in the Safe Seniors Strong Communities all-party committee I work with. But most of all, I want to thank everyone in BC for making the extraordinary sacrifices you have made over the past weeks and will continue to make in the coming weeks. And if you are a senior and need some help, call 211, and please stay home and stay safe. Thank you, and I will now take questions.
Thank you. Friendly reminder to everyone on the phone, please press *1 to enter the queue. You are limited to one question. Please also unmute your phones. You will not be audible until we call your name. First question is from Marcella Bernardo, News 1130.
Hi, Isabel. Thank you so much for taking the time today to take questions from media, because there have been many concerns being raised now about the care that seniors are getting in long-term facilities. Case in point, the Dufferin facility in Coquitlam. I've had numerous calls from people there telling me that things are horribly wrong, including family members who say it's taken them 3 weeks to get somebody to tell them how their loved one is doing. What are you doing as far as keeping your finger on the pulse of what's going on in individual care homes to make sure that people aren't falling through the cracks like what we've seen in Quebec?
That is a very good question, Marcella, and I do reach out to care homes to communicate what I hope they are doing and following in terms of the directions from the provincial health officer. I think that now that we realize what this new normal is going to look like, I think a key piece to making sure that care homes are able to give the support that is going to be needed as we look at an extended period of time is going to be looking at how we can safely open up care homes to some form of visits from family members. And I know that Dr. Henry has referenced this, and certainly I support the approach that says we find a way to safely allow family back into care homes. It won't look like it did before. I think we can all agree with that. But one of the very important pieces is that family members are, first of all, able to support their loved one in the care home. And secondly of all, we're able to be reassured of what is happening in care homes by what the sort of the eyes and that see and the ears that hear that are the family members going into those care homes. So I think we're hopefully we're stabilizing. As you know, we are I think the last count is there's 19 active outbreaks in care homes. I think 10 or 11 actually had their outbreaks declared over. And I think we are going to hopefully see things stabilize, and we'll see the resources and additional resources we might need in the care homes to help us through what will be probably about a year of the new normal.
Next question is from Angela Jones, CTV.
Thanks so much for taking my question. We know that there's a shortage of PPEs for care providers, and some are expressing frustration that they don't know how to access the provincial supply chain. So what would be your response and advice for that?
Yes, I think that the personal protective equipment issue has certainly highlighted some things we may want to look at for the future. And I think the challenge right now, and I think that Dr. Henry spoke about this yesterday, and I've certainly been speaking to a number of people, a number of care home operators about their PPE supply. And the challenge is this: when you speak to somebody, generally they have the supplies in hand for that day and maybe for 2 or 3 days. They're worried about the days after that. And the system that we have is resupplying. It's not resupplying at the rate a care home might normally supply themselves. They may normally want to have 2 weeks or a month's worth of supplies. But from what I am being told, and I've spoken directly with some care home operators as well, is that the PPE supplies in what I'm going to call the public system is more or less where it needs to be, although certainly we could give greater comfort with care homes having 2 and 3 weeks worth of supplies. That is not always possible. I think the challenge is that there's a number of people who operate outside what I'm going to call the public health system or the formal health system, who didn't think about PPE before and are now thinking about it now. So I think about a lot of private foot care nurses, for example, that operate something a lot of us don't think about, but when we get to, some of us, when we get to a certain age, we can't do our foot care anymore. And so we have foot care nurses that will go into people's homes. They wouldn't normally think about PPE, and they may not be as linked into the formal system as they need to be. But they are all linked through Safe Care BC. So I would hope that through that linkage, they would be able to get the needed supplies that they have, remembering that there's a protocol to how to use PPE and proper training in using PPE. And I think that some of the issues have arisen because there's a perception that everybody needs an N95 mask, for example. Well, if you're a care home and you're not in outbreak, nobody needs an N95 mask. They may want a surgical mask, but because you're protecting the resident rather than protecting yourself. But the use of the PPE, I think, is also some education around that would also, I think, be helpful.
Next question is from Chad Pawson, CBC.
Yes, thanks for taking the question. Can you talk a little bit more about this divide between what you see in publicly operated care homes and private operations, such as these foot care nurses? Is there more of a difference between the two streams? Are you concerned that the private sphere is not keeping pace as well as the public sphere is? And if so, what's the solution?
Well, I'm not sure. I wasn't talking about private versus public care homes per se. I was talking about in the community, there are people who provide healthcare services to seniors who may want some, what we would call PPE, that would normally not even think about it because of heightened sensitivities or awareness. I think in terms of the care homes, certainly the publicly funded care homes, and about a third of those, as you know, are operated directly by health authorities and 2/3 by contracted providers. They do have a mechanism that is binding them together. And you're seeing that in a large part around the initiatives for staffing, wage parity in staffing, and also staff being restricted to a single site. And also they are very linked in to the formal distribution network of PPE because they have that existing relationship with their health authority. So every licensed care home in the province, regardless of who operates it, is licensed by the medical health officer in the local health authority. And they have those linkages to make sure they have the proper PPE, and those care homes can phone into their health authority and say, I need some surgical masks, we've had an outbreak, we need some N95, we need some face shields, we need some gowns, and those supplies will come to them from that central hub that is supplying all of our publicly funded care homes.
Next, we have a question from Lisa Cordasco, CHLY. Okay, moving on. Hina Alam, Canadian Press.
Hi, I had two questions. One of them is really simple. I think it's, I just want a clarification on what the age is when you say senior. And also I was wondering, have you heard of any reports of increase in senior abuse since the lockdown has started?
Okay.
Thanks.
Thank you. So from the Seniors Advocate Act describes a senior as a person age 65 and over, or a person in receipt of services that are generally provided for seniors. So you might be 55 and in a long-term care home, and I would count you in my group of seniors, but certainly people age 65 and over. In terms of increase in seniors abuse, that's a very timely question because just prior to the outbreak of COVID-19, we had embarked upon, my office had embarked upon a systemic review of seniors abuse and neglect in the province, and that review is ongoing. And part of the challenge in answering your question is that we don't have a good way of measuring that. So we're looking at how we can increase awareness amongst all British Columbians of what abuse of seniors looks like and who they could be reporting that to if they see it. So we're not yet seeing that. My office, if we were to get those calls, we would redirect them to the designated agencies. I have checked in. We have not seen an increase in those calls yet. But you know, it's interesting. When I started off, I said on whatever it was, March 12th, I think it was, we declared the public state of emergency, and March 18th. That's just a little over a month ago. And a lot of things actually they compound, and we haven't seen them yet, but we might, and we presumably will as the weeks around the COVID restrictions increase. This is apropos of family caregivers. Some of them may not be feeling the intensity of the stress yet, but it builds over time. And that's the same when it comes to elder abuse and neglect, is that it's going to build up over time, just like domestic abuse, which I think Dr. Henry spoke of yesterday as well, that it's we've got to be very careful of this slow compounding rise that's going to occur as we find ourselves in close quarters with people a little bit longer.
Next question is from Bob Mackin, the breaker.
Good afternoon. We've seen various investigations into other places for seniors around North America that were sites of mass deaths. We saw the Life Care Center in Kirkland near Seattle get fines of more than $600,000 for various violations, and the owners of the Heron residence in Dorval, Quebec, are under police investigation. Should the company and the management at Lynn Valley Care Center be under an investigation? We can't let this happen again, where 20 people die in care.
Well, I think we need to understand fully what happened, why it happened, what could have been prevented, who was responsible. Was it an issue of neglect? Was it an issue of what we would call benign neglect? Was it an issue of confusion? I think we have to remember that Lynn Valley was, first of all, the first care home in Canada to experience an outbreak. And I think that we have been immersed in trying to learn to some extent from what happened at Lynn Valley to make sure that it doesn't happen again. As you know, it was quickly followed by Heron Park. And we have learned a lot from those two outbreaks. And you see that reflected in our number of outbreaks and number of people infected in the outbreaks. And hopefully, we will see that continue, that we've kept it at bay a little bit. We certainly are not experiencing what they are experiencing in Ontario or Quebec. And I think that when we get through the major part of this pandemic, there will be many examinations of what went right, what went wrong. I'm looking forward to looking at all the facts when we see them and seeing them in context. I think what's important is that we have not seen a repeat of that. And that, to me, says we learned. I know part of what was incredibly helpful at Lynn Valley was that the public health, Vancouver Coastal Public Health, got in there immediately and got on top of issues. And where you have seen some of these more tragic stories come out of Washington State, Quebec, particularly, and Ontario, you've seen that it was a longer period of time before public health got in there. And I think that that's one of the things we'll look at, what we did that was good and what we could have done that would have been better.
Next question is from John Hernandez, CBC.
Hello, and thanks for taking my question. There was a Canadian Centre for Policy Alternatives report that came out earlier this week saying that the province should transition away from private care centres, largely because workers there aren't paid as well, and ultimately I think it's the patients that suffer, according to this report. What are your thoughts on on that report, if you've read it, and a potential transition away from private facilities?
Yes, I've not read the full report. I have read highlights of the report, and as you know, some of their data was based on a report that my office released in early February, A Billion Reasons to Care. And I think what it highlights is that I think the issue around the oversight and the regulation, and that we have the system in British Columbia to which we have remedied certainly under the current orders with wage parity, where you saw these great wage differences between care homes, and what's the practical impact of that, turnover in workforce potentially, and where you saw some issues with the ability to accurately understand the number of hours of care that are being provided. I think my report was issued, and then I think it was about 3 weeks later, before the government really had a time to think about a response, COVID hit. And then I think COVID hit Lynn Valley, and then we started to see things. And so I think we need to see what's going to happen over the ensuing months. There are some initiatives that have been put in place around care homes, most particularly around this wage parity, looking at full-time jobs, how we can try and make workers be at one care home as much as possible, and how we can reduce the amount of turnover and casual. And so we may see that this, in dealing with this pandemic, some of the issues that are raised get addressed. But I think certainly a spotlight has been focused on what does staffing look like in long-term care, both in terms of the numbers and in terms of the ability to attract a consistent workforce. And that's to a large extent related to the wages. And I think that that was a big part of what the Centre for Policy Alternatives was raising, was this inequity, which we may be able to remedy.
Next, we have a question from Marc Antoine, CBC Radio Canada. Okay, moving on. Nelson Bennett, Business in Vancouver.
Thanks for taking my question. We've heard so many stories now of seniors dying alone without the ability of family members to be with them. And I've heard that this may be the case even when a senior is dying of something unrelated to COVID. This just seems horrible that family members can't be with their loved ones when they're dying. If they're willing to take the risk, of seeing their family members and then maybe going into self-isolation after, is this not something that we should be looking at? Because it just seems horrible that these people are not allowed to see their family members when they're dying.
Yeah. When the orders were given restricting visitors, and those orders came through health authority, medical health officers, there is an exemption. It's restricted visitors, it's not no visitors, and palliative is one of the exemptions, and compassionate care as well. And I am going to be communicating to the care homes to carefully look at that language and make accommodations where they can. Some do. If there is an active outbreak of COVID-19 in the care home, that makes it more difficult. But remember, we have active outbreaks right now in only 19 out of our, by the time you count assisted living, it's over 300 in the province. So the overwhelming majority are not in active outbreak. And they could find a way, and I will certainly be encouraging them to find a way for families to be with their loved ones when they are dying. I know that some are. I certainly have heard of cases of that. I've heard of some care homes simply are not aware that there is this exemption. They think there is a blanket prohibition. So again, getting that clear message out, I think, is important. And then just echoing what Dr. Henry said yesterday, we've got to find a way, if the new normal is going to be in place for about a year, we are going to have to find a way for people to see their spouse, their adult child that they're very close to. It will definitely be a more restricted way of visiting. But, people going a year or more without seeing their spouse or their adult children, I think is tragic. And I think we've got to find a way. We have to do it safely, but I think we have to make that effort.
Okay, we have time for one more question. Marcella Bernardo, News 1130.
Hello?
Hi, go ahead.
Hello?
Go ahead.
Hi. Just to follow up to my original question, Ms. Mackenzie, when I asked about a family waiting 3 weeks to hear whether or not their family member was good, do you think it's acceptable that any care home, whether they're private or public, is making somebody have to wait 3 weeks to find out if their loved one is okay?
The short answer to that, Marcella, is no, it's not acceptable. I haven't heard of that particular case. If somebody wants to give me the particulars, I can look into it. No, I don't think that is acceptable. I think these are very, very trying times for everybody. I think we need to find our compassion and humanity. I think that my former colleagues in long-term care are under extreme pressure. I wrote to them and said that I can't speak for their professional careers, but this is without a doubt the most intense time in my professional career. I was in home care and long-term care during H1N1, and it looked nothing like this. This is just, for me, unprecedented. But I think we do have to remember that the totality of a life means many things, and these family members, it is important. They're going to be very scared about their mom or dad in a care home, and we have to find the time. And I know it's very, very difficult, but we are going to have to find a way to do that and find a way to get the resources there that people can hear about how their loved one is doing. You have to remember that some seniors in care homes they can't use phones themselves. They can't use Facebook or Zoom themselves. They need somebody to help them. And we need to find a way to have that help. That's another reason for finding a way to allow families to re-enter the visiting stream under I would fully support under significant restrictions, but be allowed to do that because they can form that connection. They can, the whole family can't come in for the birthday party anymore, but if, the wife can go in with the tablet, they can set up Zoom and all the grandkids can participate that way, but you need somebody to be in there to set all that up. And so we're going to have to find a way. It's been about 6 weeks now, and that's getting on. In the normal course of events, we might close for outbreak in a given year for influenza. We might close for 2 weeks, sometimes extraordinary 3-4 weeks. This is quite extraordinary, and it's a sacrifice, and we're going to have to figure out how to do it in a way that's humane.
That's all the time we have for today. Thank you very much.
Okay. Thank you very much.